For the majority of cases, we aim at two things: safety and efficiency, always for all our patients, and this is equally provided with minimal invasive cardiac surgery. Minimally invasive heart surgery, in short, means we avoid to open the chest bone to address the heart disease. We can do all these procedures from small keyholes, small incisions, measuring just a few centimeters, on the side without breaking bones. That means that the patient will mobilize faster, will breathe better, will have a smaller trauma, can drive, can swim, can sleep on the side without restrictions, as opposed to the open surgery, which involves opening the sternum, the chest bone. Of course, we also enjoy a much better cosmetic result when we do the minimal invasive heart surgery. But see, I mentioned that last. It's not the most important thing. The most important is that the patient experience throughout his surgery and hospitalization is a totally different one. The applications of a minimal invasive heart surgery depend on the kind of disease the patient presents with. If the patient has mitral valve disease, for example, mitral valve leakage, then we're looking at a minimal invasive mitral valve repair. The valve is rheumatic or destroyed or calcified, then we're looking at minimal invasive mitral valve replacement. And we have various options again: biological valve, mechanical valve. We discuss all these things with the patient and the patient can choose. Then we assess the comorbidities of the patient. Did the patient have irradiation before? Then we may not be able to conduct the surgery minimal invasively. Has the patient severe asthma? In order to do the minimal invasive surgery, we have to deflate that lung for the duration of the surgery and inflate it back at the end. But patients with asthma don't take it very well. I mean, I'm talking about really severe asthma. The most challenging cases, which at the same time are most satisfactory, both for the family as well as for myself, is of course the difficult cases, the high-risk cases, which we manage to put back on their feet and send back to their lives. This is, I guess, the greatest team accomplishment we have achieved. Also, patients who have heard that minimal invasive is not possible, or whose valve is rendered destroyed and cannot be repaired. And we managed to produce a good and robust result, proven by evidence and quality assurance scans, is of course, it gives us a sense of accomplishment.